Today we are going to demonstrate a typical trauma assessment, including the scale of joint immobilization. In this specific call, our patient has suffered a broken arm as a result of a skateboarding accident. The action of joint splinting itself is beneficial to our patient by aiding in pain control, preventing further injury to the surrounding areas such as nerves, arteries, and veins, and muscles. In addition, splinting can help control bleeding as well as preventing a closed fracture from becoming an open fracture. There are many different types of splints EMS providers use in the field. Today, we will demonstrate with a cardboard splint. Cardboard splints are popular within EMS because they are extremely cost-effective. Cardboard splints come in a wide variety of sizes and can be cut and or manipulated for all different situations and injury locations. They are disposable and can provide sufficient rigid support for immobilization. Because cardboard splints are disposable, they are invaluable to helping to break the chain of infection and preventing cross-contamination that can occur from improper sterilization before reusage.
Since cardboard splints come in different sizes, their cost can vary, but generally the average cost is only a few dollars per splint. They can be cut and shaped as necessary, but in reality, in lack of a commercial splint, really you're limited only by your imagination. Newspapers or a magazine can be used as a splint in a makeshift situation or an emergency situation in the home. To make sure that the splint is completely immobilized, you're going to need to fill the void with padding. The commercially available splints come with a thin foam padding on it, but generally it's not enough to completely immobilize the arm within the splint itself. For any splint to be effective, both bone ends and the adjacent joints need to be completely immobilized. Again, this will prevent additional injury to the soft tissues and nerves, arteries, veins, and muscles that are inside the arm. It can prevent a closed fracture from becoming an open fracture, can help minimize blood loss, and it will definitely decrease the patient's pain. If for some reason the joint is disfigured, you may need to realign the joint and provide some slight traction to restore circulation to the extremity, and so you can fit the arm or leg into the splint itself. This may be momentarily painful to the patient, but the benefits of increased circulation, protecting the soft tissue, and relief from the pain of the original deformity are well worth it. For splints to be effective, the injury site as well as the joints above and below the injury need to be immobilized. In the case of a forearm, the elbow articulates in two directions. The wrist, however, not only bends back and forth, but also swivels. So you can see that this bone inside the arm, if it was broken, there's a lot of different manipulations that could occur if you allow those joints to move. You also want to put the hand in what's called the position of function. You want to make sure that the hand is relaxed, the fingers are curled. Generally, it's easiest if you wrap the fingers around a gauze pad, part of the padding itself, or even the end of the splint. And placing it in that position of function will help keep the muscles in a relaxed position. For our scenario, you'll observe our EMTs handle a trauma assessment regarding a broken forearm.
BSI, scene of safety. Okay, so I'm going to determine the mechanism of injury, which is a fall from a skateboard. I only have one patient here, and I want to call for additional EMS resources. And sir, did you hit your head or lose consciousness?
No, I was doing a sick grind on that rail and I fell on my forearm.
Sick grind on the rail. All right. So C-spine's not necessary at the moment. My general impression of this patient is a male in his mid-20s. He was alert and tracking me while I was walking up to him, and he is obviously holding his arm, which indicates a possible injury. With that, my partner here is going to obtain a set of vitals. I'm going to get with his mental status. And sir, do you know your name?
Drew?
Drew, okay, I'm Justin. I'm from the ambulance. Do you know where you are right now?
Ventura.
And do you know the date?
18 18th,
Okay, and what year is it?
2019.
Okay, perfect. So
Take a
he's
breath.
A&O times 4. Going along with that, I'm going to assess his ABCs. So just by him talking to me, I know that he has a patent airway, and his breathing, rate, rhythm, and quality, all good. And circulation, I'm going to go with radial pulse. Okay. So pulse is good. I'm going to check skin signs.
Breath sounds.
He's warm, pink, and dry. And then with the GCS scale, he has hit at 15, so that's perfect for me. So what we're going to do here is we're going to stay and play because he is a low priority patient. My partner's here is going to continue his vital signs while I'm going to check for decap BTLS, and that stands for deformities, contusions, abrasions, puncture wounds, burns, tenderness, lacerations, and swelling. So I'm going to start off with the head. Check decap BTLS. Making sure if there's any cerebral spinal fluid, battle signs, raccoon eyes. I'm going to check his mouth, make sure there's no missing teeth or blood inside his mouth. I'm going to go over to the neck. I'm going to look for any JVD or tracheal deviation. I'm going to move down into the chest, check for that. Go down to his abdomen. All right, and then check decap BTLS on the pelvis. And then move down to the lower extremities. Make sure I don't find anything here. Okay. Alright, so I found nothing. I'm going to go up onto his upper extremities.
You want to relax for it, please?
Alright, so I found nothing. The only thing that's obvious would be the injury to the right forearm. So now my partner is going to show you my partner's going to show you how to splint the forearm. Okay. And then,
Alright, sir, I'm going to measure on your non-injured extremity.
and while he's doing that, I'm going to check CMS on his injured arm. So, sir, I'm going to check for pulse real quick.
Measure to the elbow.
What finger am I touching?
Pinky.
Pinky, okay. And then can you squeeze my hand for me? Alright, good. So CMS
Alright,
is
sir.
intact.
Continue to hold your arm, please.
And my partner's going to continue with that splint.
Alright, I'm going to pad the voids here. Alright, sir, I want you to gently place your arm into this splint. Just kind of support it with your non-injured arm, please. Okay. And then kind of just lightly hold that in your hand. I'm going to continue to pad the voids. Alright. Can you get CMS for me, please?
So I'm going to check again for CMS. So I'll go for a radial pulse. Okay. And what finger am I touching?
Middle finger.
Okay. And then can you wiggle your fingers for me? Alright, perfect. CMS is still intact.
Kind of knock that for me, please.
Okay.
Alright. So we're going to slide your arm through
Do this.
this
Slide your arm
sling
right
here.
there.
Okay.
Got it. There it goes.
Alright. Take that side.
Got it.
Tie that off to the side.
Okay. And after applying the sling, we're going to check for CMS one more time. So we'll go for radial pulse. Got it. And then what finger am I touching?
Pinky.
Okay, can you wiggle your fingers for me? Perfect. Okay, so after doing that, we're going to lift the patient up and help him to the ambulance. So I'm going to position the patient's leg like that, and I'm going to have him roll on his knee. We're going to get him up. We're going to demonstrate proper lifting techniques as well. So back straight and on 3. 1, 2, 3.
Just to briefly recap, after proper use of BSI and scene size up, the EMTs were able to determine the chief complaint and take action. They manually stabilized the injured site, appropriately measured and applied the splint as to immobilize a joint above and below the injured site in a position of function. They secured the entire injured extremity and assessed the distal motor, sensory, and circulation function of my injured arm both prior and after splitting. Good job, guys.